professor, physician, epidemiologist. I am Dr. Sri Banerjee. Hello, everyone. I'm Dr. Sri Banerjee, core faculty for the College of Health Sciences and Public Policy at Walden University. And in this video, I would like to provide you with some some teaching points in the process of describing to you how I actually collaborated with one of my students to write this paper and put it together. Just right off the bat, what I'm going to say is this: this analysis was conducted in SAS. We were unable to conduct this in SPSS, so there were things in this modeling. This is a forecasting modeling system, and so in certain statistical packages, this is better handled. And so when we're talking about trend analysis then and forecasting, SAS is superior in this. Now, the objective was we were trying to replicate, we already had a model, an existing model of the Healthy People 2030 within the United States. We knew this was a really good approach. This was done for Healthy People 2020 and all of this. But when we looked in other countries, specifically India, there were really no targets or no specific country level objectives, which were data driven and evidence based, which we could really find in the literature. So that prompted us to explore what was existing within the dataset. And you can see here, even after we put together all of the material and wrote the paper up, it took about 6 months or so, or 7 months before this was actually accepted and then available online. So it was received back in November, but then didn't get accepted until May. So there was a lot of dialogue and trying to determine what was needed to be included. The other challenge here was that we were restricted with the number of words that could be used within this article. So because this was a research brief, we needed to work with limited words. So we were able to demonstrate the modeling, and here's kind of the years and the progression, and this is the age-adjusted prevalence rate. And so based on the previous trends and lags, a specific ARIMA model is fit so that this can actually explain how the trends will appear in the future. So this is kind of the basis behind the forecasting. Now, all of this blue that you see, all of this blue is the uncertainty. So as you can see, and as you would expect, the further you go into the future, the more uncertainty you have to deal with, because the less you know about the parameters that will affect what is in the future. So the idea is the time that is currently happening or happening in the near future is much more influenced and much more predictable, which is why the uncertainty interval is smaller at the beginning. So it's much more, but as time progresses, that uncertainty starts to increase. Which is why forecasting is such a critical component of even initiative planning or anything of that nature. So anyway, we looked actually at some of the current uh, well, actually, this was as of 2017 numbers, 1990 numbers, and then the projection into 2030. And I really think projections and forecasting models are important in being able to appropriately have have targets then to work with, similar to these sustainable development goals. So if you have these numbers, then you can fit them neatly into the targets that are already available within the SDGs, and then work from there. So a couple of things. What did we learn from this paper? And so we ended with actually three objectives that needed to be addressed, and gave three recommendations, and that was the following. The evidence for projected increases in the demand for healthcare for cardiovascular disease patients can be used to effectively and efficiently direct resource allocation for the promotion, prevention, and rehabilitation of cardiovascular disease. Since only around 37% of the population were covered by any form of health coverage in 2017 through 2018, including public health insurance schemes and commercial insurance, it is important to make resource allocation and health access based on this context. So, context driven um, decisions are extremely important. And what we did in this first objective really is go in and use, as you could see, we used one number, but try to pivot everything around this one number so that it gives people a sense of urgency as to why things need to be done. Um, our results elucidated a forecasted trend of continued male stroke prevalence growth, while overall mortality rates and female stroke prevalence rates are anticipated to decline. So, basically, in a nutshell, more focused efforts to understand the contrasting trends and their drivers are required. So, accordingly, targeted promotion of technological innovations like telestroke can help to provide care in areas without sufficient healthcare providers. This is again in resource poor settings. This is especially important because we're trying to make sure in rural areas and even in villages. And I was actually listening to Prime Minister Modi's speech during Independence Day. It was actually the 76th Independence Day this year, and he was talking about promoting digital technology in villages, and being able to broaden access. And so this same goes true for healthcare. And then targeted, cost effective, evidence based practices are needed that include preventive, self care, and management of modifiable risk factors. So it definitely it's important to promote awareness about some of these modifiable risk factors. For instance, um, if cigarette smoking is a is something that is needing to be addressed within a community, or biri, smoking of biri, which is a local herbal kind of addictive substance, then and it could be a risk factor for cardiovascular disease. Actually, is a risk factor for cardiovascular disease. Then that specifically uh, needs to be addressed within the community. So, of course, likewise, these approaches should be addressed at the state and local level and be gender specific. This in turn will reduce economic hardship secondary to cardiovascular disease related healthcare costs. So we were really specific about our objectives. We intentionally kept a lot of lot of the results brief, provided just a couple of tables and figures, but got the point across in terms of what are some of the forecasts in the next 10 years for India in terms of the burden of cardiovascular disease. Um, I hope this has given you some insights. Thank you for listening.